Close suctioning procedure. Close suctioning allows a suction catheter to be inserted into the endotracheal tube through a one-way valve with no need to disconnect the patient from the ventilator. Purposes: to clear airway secretions, to maintain airway patency, to provide effective ventilation, to maintain oxygenation and prevent hypoxia during procedure, to reduce the risk for contamination from outside pathogens, to protect patient from ventilator associated events and ventilator associated pneumonia. Indications: noisy breathing, visible secretions in the airway, suspected aspiration of gastric or upper airway secretions, clinically apparent increased work of breathing, deterioration of arterial blood gases, patient requests suctioning, low oxygen saturation, radiological changes with consistent retention of pulmonary secretions, ventilator alarms for increased proximal airway pressure, decreased breath sounds or absent chest movements, suspected ET obstruction. Points to remember: explain the procedure to the patient if patient is conscious and comprehending. Working wall or portable suction. Set pressure at 80 to 120 mm of mercury. Maintaining aseptic technique. Procedure for closed suction method. Pre-procedure: collect the articles near the bedside of the patient. A tray containing stethoscope, syringe with sterile water, clean gloves, close suction catheter. Perform hand hygiene and wear PPEs. Parts of the closed suction catheter: patient end connector, breathe airway connector, close and open valve, medicine injection port, flushing port, suction catheter, polyurethane sleeve, suction catheter connector, suction control valve. Assessment of the patient. Look for saturation of patient, respiratory rate, breathing pattern, secretion in endotracheal tube, observation of ventilator parameters, and assessing the patient's need of suctioning. Listen. Auscultate the lungs for the air entry. Position the patient in semi-Fowlers with head turned to one side. Open the suction catheter and connect to ET tube and ventilation circuit. Attach the day change sticker. Connect the wall suction line to catheter. And set the vacuum. Attach the vacuum to the closed suction system. Rotate the knob to the left side. To carry out the suctioning, stabilize the manifold and ET tube with one hand. Then, with the thumb and forefinger of the other hand, advance the catheter down the ET tube to the desired depth, about 37 centimeter of the catheter. Suctioning needs to be applied for 2 seconds before starting to withdraw the catheter. Depress and continuously hold the thumb valve while withdrawing the catheter slowly. Do not depress it intermittently. Stop withdrawal when the black marker ring appears inside the sleeve, and release the thumb valve and immediately rotate the knob towards the right side. Do not pull too far or you will stretch the sleeve. The irrigation port should be used to clean and rinse the catheter when the suction procedure is completed. Remove the syringe and close the port. Simultaneously, depress the thumb control valve to clean the catheter. Continue to irrigate until the catheter is clean. Disconnect the suction from the closed suction catheter. Post-procedure, repositioning of the patient and suction tubing. Check ventilator and observe patient. Assess vital signs, breath sounds and oxygen saturation. Wash and replace the articles. Wash hands and dispose of gloves. Document time, condition of the patient, type of size of catheter used, airway secretion color, significant events and signature.